Cheers.
The vision of the world of healing is to discover, celebrate, and reveal different types of healing techniques, systems, and philosophies. By exploring and honoring these different practices and healing beliefs from around the world, listeners will be able to learn more about different cultures and be exposed to ideas that they may not have heard before. Our vision is to expand the listener's mind about what is possible in the world of healing, while at the same time helping people realize that we are more similar than we are different. This is the World of Healing with Dr. Vanda Corbett. On today's show, we welcome Cathy Van Harmelen, a Bowen Therapy Practitioner who is here to open our mind to the world of Bowen. Welcome to episode 3 of World of Healing, and today I'm so excited to have Cathy Van Harmelen. Did I say that right? Yeah, okay. Cathy Van Harmelen on the show, and she is a physiotherapist by trade, but she is a Bowen Therapy Practitioner. Is that correct? Yes, as well. So today we're going to talk about the world of Bowen. It's very exciting. So Cathy, tell me where you're from, how you got into Bowen, all that good stuff.
Well, I'm from South Africa and studied physiotherapy in Pretoria, and I've been a physio for 13 years, and I've been doing the usual musculoskeletal problems, back, neck pain, knee problems, worked in a sports clinic, so saw a lot of issues, but I got to a point where I got really frustrated with the tools I had.
As we all do sometimes.
Yes.
Yeah.
And patients would come back. I would help a lot of patients, but some patients or clients would come back with the same pain, got this pain again, and it's like, oh, okay, let's do that again. But what I was doing was not achieving what I wanted to achieve.
Yeah, and you weren't really reaching the health goals that the patient and you wanted.
Exactly.
Right? Yeah.
And working with clients for a number of years, I know there's more to a client than just the shoulder pain. There's emotional stuff, there's trauma, there's history to that person. So I was looking for something different, and I didn't know what I was looking for. I was like, what?
You too was right. I still haven't found what I'm looking for.
And I don't know what happened. I became pregnant, and I think that put me on a path of trying to be doing things as natural as possible.
Okay.
So I knew I wanted to go a natural birth, natural stuff, didn't want chemicals, which I did at the end. But this put me on a path of some holistic treatment and therapies, I suppose. But what happened, I think Bowen Therapy found me, because I was, as you do, you scroll through LinkedIn when you're bored, and every now and then I would just see Bowen Therapy, and I probably scrolled through it I saw it probably 10 times. Really? And eventually I was like, what's this Bowen Therapy? I've heard about it before, I'm not sure. Yeah. When I read about it, it was like, this is what I want to do. I've never had a Bowen Therapy session in my life, but just the explanation of what they do and how they do things, just said, I want to do this. Yeah. I was here in Dubai at the time, pregnant, couldn't travel because the courses are done in Australia and in the UK, and I couldn't travel back and forth. So I just found someone on Facebook actually who's doing Bowen Therapy in Dubai. Okay. Messaged her and she's like, oh, by the way, we're doing a course in 2 months' time. Do you want to join? I'm like, yeah. And that's basically where I started Bowen Therapy.
That's
and
amazing.
That sort of put me on a path of looking at the person more holistically than what I used to do. Yes, we do look at the posture and we looked at different things, but with Bowen Therapy, what's nice about it is we can treat the whole system in one session, which is not always possible with physiotherapy. Because if you have shoulder pain, the client wants you to work on that shoulder. Yes, the hip might be a bit stiff, but that's maybe for next session. But with Bowen, I can actually address that shoulder and the hip at the same time, or in the same session, which is really helpful.
No, it's amazing. A lot of times with patients, it really is like the physical, chemical, and emotional levels. It's the 3 tiers of healing. In chiropractic, we call it thoughts, traumas, and toxins, right?
Absolutely.
Like all the stuff that goes together. So a lot of people don't know what Bowen is. Yes. So what is it?
Bowen comes from the guy who started Bowen Therapy. His name was Tom Bowen from Australia. He was born in 1916. And he started, I think, with his therapies in the 1950s after the war.
Okay.
But he wasn't formally trained in any sort of therapy as such. He just really had a gift. Some people just have a gift of healing.
Yeah.
And he started massaging footballers. He used to go to games. He used to work at a cement factory. He used to work on his fellow colleagues, and it just progressed from there. And he, I think, he experimented with different procedures and techniques through his whole lifetime.
Yeah.
And he just sort of found techniques that work.
Okay.
Very different to just the traditional massage. He did have some influence from osteopaths and chiropractors, and he did study some anatomy texts and acupuncture.
Yeah.
But it was really just experimentation. And at the end of the day, they did a survey, the Australian government did a survey and found that he was treating 13,000 clients a year in his clinic.
Wow.
Which means he was seeing
250 a week.
Exactly.
Yeah.
Which is quite impossible for normal therapists. So he was literally going in, doing a few moves, leaving the person, doing a few moves, leaving the person. Today that's not the case because we have to do a full, we don't have his gift of just knowing where to press. So we have to do a system of treatment. And there were 6 therapists that he sort of allowed to observe him or worked with him.
Yeah.
And they set up a structure that makes sense structurally.
Yeah.
And after his death, they started teaching it.
Okay.
And there's a few different schools, and I studied with Bowen, which is from, they are in the UK.
Okay.
So it's we call it a Bowen move.
Okay.
A Bowen move consists of a gentle pressure on a specific point in the body.
Yeah.
Most of these points correlate with acupuncture points. Actually, they found that it correlates. So it's on a specific point in a specific sequence, and it's sort of, we're talking a language to the body, and we're sort of catalyzing a shift, for the body to sort of shift into a parasympathetic state.
Right.
Because the moves are very gentle. It's on specific points, as I said, and you give a little bit of pressure, and then you do a roll.
Okay.
So the pressure, we call it challenge on the muscle or tendon where we're pressing on,
Yeah.
and then we roll over that muscle or tendon, but very gently, so it's not
Can you demonstrate on my arm, kind of?
So that's
It's very light.
a challenge, and that's a roll.
Okay.
So it's as if
Yeah.
nothing. But we've got a lot of receptors in our body.
Mm-hmm.
A lot of them are interstitial receptors, which respond to soft touch.
Right.
And we've got other receptors on the muscles and tendons which respond to different pressures.
Yeah.
So if I'm treating someone, I might do a very deep pressure on the hamstring, but do a very light pressure on the side of the face, because there's different receptors and there's different things happening.
Yeah.
So basically what this does is almost like we're putting in new data into the body.
Right.
So, for example, as a physio, what I'll do is I'll structurally look at your posture.
Mm-hmm.
Say you've got shoulder or neck pain. I'll go look at your posture, do evaluation.
Okay.
Obviously, get the full history as well.
Yeah.
And
She has lots of training before this, by the way.
Get the full history.
Yeah.
Making maybe a mechanism of injury, maybe other things as well.
Yeah.
But then on a structural analysis, we'll look at the body in a whole, sort of look at it at a whole.
Yeah.
So we'll look at the hips, we'll look at the shoulders, the neck, as we do with, when we are body workers.
Yeah.
So I won't just look at your shoulder, I'll go look at your hips. Is your hip a little bit higher than the other hip? Is your leg a little bit shorter? So,
Shoulders.
Exactly. So we've got crossover syndromes. So your hip might be a bit higher on the one side, which causes the muscles very tight on that side, which is causing a tension on your shoulder. So you have pain in your shoulder, but actually the problem is in your hip area.
Where the cat is the problem and where it's screaming. They're two different problems. Yeah.
Exactly. So in the Bowen session, there's some basic moves that I do.
Mm-hmm.
We call them basic relaxation moves. They basically catalyze the body into a parasympathetic state. So getting your body ready for treatment.
Okay, so first let's just tell people what a parasympathetic state is. Because I think a lot of people are like, what are they saying? So there's really, part of the autonomic nervous system, there's like 2 states. There's sympathetic and parasympathetic. And sympathetic, I used like to call like the gas, and parasympathetic is the brake. Yeah.
Sympathetic, fight and flight.
Fight and flight. Yeah, fight and flight is sympathetic, rest and digest, parasympathetic, right? So the parasympathetic is the state that you want to be in, and that's the only state that when you're in, you're healing. So you don't heal in a sympathetic dominant state. Unfortunately, today's world, we're always in a sympathetic dominant state, right? We're always on our phones, we're getting notifications. The tiger isn't attacking us anymore, but we're still in that, like, life is attacking. Life is coming at us.
Yes.
So that's a sympathetic state. But a parasympathetic state is where we're actually healing and where we're relaxing, and that's when, like, life can take. Exactly. Yeah. So by doing the Bowen, you put it into the parasympathetic state.
Exactly. So if someone would come just for those basic moves, they would walk out fully, like, chilled out, relaxed.
Zen out.
But changes might start happening, but maybe the cause hasn't been addressed yet.
Okay.
So with the Bowen session, evaluation, postural evaluation, finding those tight muscles, but then starting with some basic relaxation moves, which puts you in like a relaxed state. And then I can go work on those tight areas. So for example, if we're talking about the hip, I'll do some specific moves on the hip area, on the back, and then maybe I'll go to the shoulder, maybe not in one session, but by doing this here, already, maybe your shoulder might feel better already. I might not have to do anything on your shoulder. Yeah. I might need to, but you know, everybody's different. Yeah. And what it basically does, it catalyzes that shift of healing. So it's like, you know, if a car is on the edge, you just have to push it and it will go over. So that's what sort of Bowen does. It just gently nudges the body into the right direction, just so that it can go into the abyss of healing. Yeah.
The abyss of healing. That'll be my next show. Not world of healing, the abyss of healing.
Not bad abyss, but good abyss. So it just needs that little shove to, you know, start the healing process. So for us, we don't want to overload the body. So I might not do a lot on one session. I might do a few things here, a few things there, just to catalyze that shift. And then next time, oh, that's better. Okay, now we can work on something else. Right. So we're all onions, right? Yeah. Or artichokes.
Artichokes. We usually said this on the last one. Yeah, the artichokes. You peel back the layers to get to the heart.
Absolutely. With the body work, your structural body is the same. So you might have these top layers that are all tense and like screaming at you. And once we peel those layers, then we can get to the deeper layers. Oh, maybe there's an injury that was there 10 years ago that needs to be worked on, but all the other layers are on top of it. Right. So as the treatment progresses, we get deeper and deeper and deeper, and we get to the core of where we're supposed to be. Yeah. It's not perfect. Life happens. Yeah. We travel, we carry heavy bags, and we're back to square one, square two, and then we have to do some treatment again. But it really, what I found with Bowen is, it really helps with old injuries, chronic stuff, things that have maybe reached a plateau. Yeah. That you've reached to a certain point. Yeah, it's niggling, but it's, you know, I can live with it. Yeah. Where Bowen comes in, we sort of can get to the core of that niggling pain, and we can sort out the core, and that niggling pain goes. Right. And you might not feel it ever again. Oh, which is awesome.
Yeah, a lot of times we get to a place where we call like maximum medical improvement, or MMI, where like no matter really what else you do, you might be 80% better, but there's always that like 20% that kind of lingers around. So you're like, you kind of come in and work on that 20%.
Yeah. which is nice.
Yeah,
which is quite fulfilling. See a lot of people that have, this pain has been there for 20 years, and you know, after three sessions, it's not there anymore. Yeah. Which is great. Which
is so fulfilling as a practitioner, as a healer.
Yeah. Absolutely.
So what kind of like, besides the chronic stuff, what other things that you find are really affected by working with Bowen?
It's all the musculoskeletal things. So it doesn't necessarily have to be chronic. It can be a back strain that you had yesterday, where we come in with some Bowen moves, might just calm down the body, you know, get the spasm to calm down. Yeah. And I believe the quicker you get into that area with gentle stuff, gentle treatment, the quicker it can heal.
Usually, yeah.
So if you've had a pain for 3 months and you've had a pain for 5 days, you might feel better sooner with the, you know, if you came in sooner.
Yeah. So I find that in my patients, bless them, I find a lot of times what they'll actually say is that they're literally waiting for the pain to go away before they'll see somebody. Yeah. And you're like, what? Why would you wait? Like, come see me now. You know,
Yes,
like
exactly.
now is the best time,
Yes.
not 2 weeks from now.
Exactly.
Now, right? So yeah, I'm glad we see the same people.
I've had this pain for 6 months. I'm like, why don't you come 6 months ago?
What? Yeah, it's a little
But that's, we
frustrating.
all do that, right?
Yeah.
Let's not
Cathy,
start.
I've had several sessions with Cathy before, with Bowen, and I always just walk out feeling like incredibly zen, like I've meditated essentially for a couple of hours. Is what I feel like.
Yeah.
It's just very calm and relaxed, and my range of motion is improved. So it's always such a treat to be treated by her.
But yeah, basically it's putting you into a state of meditation without even trying to meditate, actually,
Right.
because it's using physical input to calm down your brain. So you don't have to say, oh, I don't have to think about something. But at the end of it, you actually are quite chilled out and quite zen.
Very zen.
And that's what we need a lot of times. So that's the other thing. It's musculoskeletal problems, any type of injury, but also stress-related issues. So, stress, anxiety, depression, all that. So sometimes just a bone session just helps to calm down your nervous system so that you can cope with all the things that you have.
Absolutely.
Just to take that breath. And basically what I also feel is I'm holding that space for that client because I'm forcing you to lie down for 45 minutes to an hour.
Yeah. And not do anything.
Not do anything.
You're not looking at your phone.
Nobody's calling you.
Yeah.
Phone is off. So I'm creating a space where your body can go into that healing mode.
Yeah.
And I'm holding that space for you, where your body can do what it needs to do.
Yeah.
So any stress-related stuff can help. If you just need to chill out a little bit and just to relax a little bit, Bowen can do that as well.
Oh, that's amazing. So it's almost like an attitude adjustment.
What I got from having Bowen myself as well, from having Bowen, it's just you have this calmness inside you. Just like, okay, all these things are happening around you, but I can handle it. It's no circumstances are really changing, but it's like you've changed a little bit inside, and you can just cope a little bit better.
You are one of the calmest people I know. She always does have this like aura of calmness about her. And like sometimes I'm a little like, and she's just like, it's okay, Vanda, just breathe.
And that's a lot of Bowen.
It's a lot of Bowen, it's a lot of self-care, a lot of work.
I think so. So
that's amazing.
Other things that it can help with, what I believe is it catalyzes the shift, and it puts new information into the nervous system. So it basically calms down the nervous system. So I believe whatever the body is able to heal, you can start letting that ball roll. So it's not always musculoskeletal stuff. I've had clients with bloated tummies just because of stress, and after having some 3 or 4 sessions of Bowen, that bloating is all gone without really having to change a lot of things. Maybe they had to look at their diet a little bit and reduce the stress a bit, but also just so other things can help. It can help other things as well. Can help migraines. It can help with kids. I've seen a few kids with ADHD. Really calms them down as well. The kids usually love it. Just give some more of that.
You just hop on your table, right?
Exactly.
So
I've had parents who come in. They're like, "What did you do? Like, he's not having his outbursts. He can calm himself down more quicker than before." And it's just sometimes those kids are so tense as well that if you just release the structures and calm down the nervous system, they can just breathe as well. So things like that as well. So it's musculoskeletal, stress, kids, ADHD, autism, and things, sometimes hormonal stuff, digestive stuff, but that's when you calm things down and you help the body just to do what it needs to do, then those things sort of fall into place as well. So I'm not saying I'm healing,
No, but you're just helping the body be able to essentially heal itself.
Exactly.
And
if it can, it will.
And you're just giving it that space and that opportunity to, even for the, like, as you were saying, just that hour for the person just to not be on their phone, to completely relax, just do their thing. I mean, sometimes that's enough to even just kickstart the healing process in the body.
And what I find as well is once they get into that state of they feel relaxed and they feel this healing happening, they do more things. The clients actually,
of course,
automatically do things that are more healthy for them.
The body wants to be healthy.
So they start exercising. Like, I don't know why I went to the pool and swam 10 laps. I'm like, I know why.
Or they went to the mall, but instead to shop, to actually just to walk during the summer heat.
I don't know why I decided to eat some healthy food this time, not the fast food. I'm like, because you're in that state of healing, your body wants that, and you're sort of more encouraged, or internally more encouraged to do that.
Exactly.
Automatically, without really having to think about it.
Well, the body wants to be healthy. Yes. You know, sometimes we just have to get out of the body's way.
Yes, exactly.
You know, we gotta like shut off the mind a little bit and actually listen to what the body is innately telling you to do. Like order the salad, not the cheeseburger. Exactly. You know, or order the. I'm not saying I like cheeseburgers too, but it's okay. Yeah. But like, but not all the time, right? But like, order the salad, order drink water instead of soda.
Exercise,
you know, but it's just exercise. So it's always that. Just the body is actually trying to be healthy. It's trying to make good decisions for you. But a lot of times it just, you ignore it.
Yes. What I believe is the body has a blueprint of how it's supposed to be. And I think it's just getting back to that blueprint. We don't always achieve 100%, but we can go as close to it as possible.
Yeah, absolutely. Yeah, all the twists and turns and the all the rooms with the door but no wall. Yeah, well, that's amazing. So, where would you like to see like Bowen go in the future? Like, what's your
me?
Yeah.
I would like to just have much more and more experience with Bowen.
Yeah.
To basically see more and more clients, and I know it's not possible at all, but my goal is for everyone to have at least one Bowen session in their life.
Yeah.
Everyone should at least have it once. Because once you have it, you're like, I feel so different.
Yeah.
So that's my end goal.
Amazing.
I might not reach it, but I'm slowly but surely educating. In Dubai, Bowen is not very well known.
Yeah.
So I'm trying to educate as much as possible. And then once people understand what it's about, then they come in for treatment.
Yeah.
So my aim is to see more and more clients. Every client, I love seeing clients, and everyone is different. There's not one person that's the same. And just see more and more and help more and more people. That's just my basic goal.
Yeah, it's amazing. It is so true that we really need to like educate people what you do, and then they're like, oh, it's not crazy.
Yes, exactly.
You know, it's like, oh, you mean I just kind of get to lay there for an hour and relax and
you just press some points.
It's not so scary. Like, I can handle that, you know, because a lot of times I know when people come to see me, they're very like have a lot of fear in what I do, just because they haven't been educated as to actually what we actually do, or they saw a video on YouTube, or like, you know. So hopefully this will help dispel some of the myths about what actually Bowen is.
Yeah. So many people ask me, is it like massage? I'm like, no, it's not like massage. We're still touching the body. Yeah. It's very different to massage. Very different. And only once you've had it done, you can actually say, oh, that's what I can explain to you till the cows come home.
Right.
But once you've had it on yourself, you're like, then your body knows, oh, this is good for me.
Yeah.
That's my goal. Everybody just should feel it, and maybe it might not be the thing that you need right now. The way I see things is, you have a destination and you have 5 different routes to get there, and that's how you've got Bowen, you've got Chiro, osteopathy, acupuncture, and your body might just need a specific route at the time that you are having that problem. Yeah. And if you've had Bowen before, maybe you have your issue and then you say, oh, maybe I should try Bowen. If I tried everything else, maybe try, and it might work. It might not work, and then maybe acupuncture might work, or
exactly.
Chiropractic.
Yeah, it's one of those. It's interesting, like you said, it found you, you know, and so as a practitioner, but even over time, a lot of times, the alternative, not even alternative, but the therapies that come to people, they usually show up when they're needed.
Exactly.
Right? So it is amazing. They may have never heard of this before, but you might be at home right today watching this YouTube video, and all of a sudden be like, Bowen, I'm going to give that a try.
Yeah. The way I see it is, if it resonates with you, if it's like, oh, I really want to try it, if you really like, if something inside you says, let me try it, then try it. Yeah. You might have one session, you feel quite chilled, and okay, that's fine, but at least try it and see if it's something for you.
Absolutely. Yeah. So do you have like one like challenging case that sticks out of your mind that has amazing results?
They're all challenging.
Yeah, it's true. That is true.
person is challenging.
So yeah, so maybe that's not the right word. But do you have one case that you can tell us about that really kind of stands out?
No, because like I said, every person is so different.
Yeah.
And that's what stands out to me is when I get a person in or a client in, every single person in my 13 years of seeing clients,
Yeah.
there's not one person that's the same as the other person.
Yeah, of course.
They don't have the same history, they don't have the same emotional stuff
Yeah.
happening. So that's exciting to me. Like every person is different, and what I'm
Yeah.
going to find in the body is different, and how the body's going to react is different. So every person is challenging, and every person's reaction to me is exciting.
Yeah.
So when I see that hip going more level, I'm like, yay! Type of thing. So that's every single client for me is, if there's some changes at least, if I make at least one change,
Yeah.
at least then I'm happy. If the pain might still be there, they might need to do different things and do other things to help it. But if I could make a little change in their body, then then I've done at least what I could do.
Yeah.
Basically.
Yeah, you've done what you could at that time.
Exactly.
Oh, that's amazing. Do you have any final words for
Everybody.
YouTube universe?
Final words. Like I said, everybody needs Bowen.
Everybody and everybody, right?
Exactly, that's what I'm saying.
Yeah.
Everybody can do with a Bowen session,
No,
even if it's just 1 or 2 sessions.
Yeah.
Just the other thing I would like to say is just try it out and don't sit with the pain. We're not supposed to have pain all the time, and we just get so used to. Sometimes we get used to the pain, and we don't know how it feels without the pain.
Right.
And I've had clients saying, "Oh, I feel so good. I don't have pain. I didn't know how it felt that."
And they didn't even realize how much pain they were in
Exactly.
until they are out of it.
So that's my message to whoever's listening is: if you have that pain, don't wake up with that pain every morning, or don't go to sleep with that pain every night. Do something. Just take that first step. Go to Google, find someone who does something.
Yeah.
Take the first step, and then, good things might happen. But you might have some bumps along the road. Might go to the wrong.
Just keep
ways,
going though.
but just keep going. Just keep one step at a time. That's what I think.
Well, thank you so much, Cathy, for being on. I
Pleasure.
really appreciate it. And
I didn't talk too much.
No, she's amazing, right? You can just give her, just give you and go. Can you show them your cup, please? This is going to always be awesome. I love it.
That's I'm an awesome friend. Thank you.
Thank you so much. And until next time, have a great day. Thank you.
Bye.
Thank you for watching. This podcast should be listened to as educational purposes only. This is not intended to diagnose or treat any disease. Please do not apply any of this information without speaking to your own personal doctor first. If you liked what you heard, please leave us a comment or get in touch on Facebook or Instagram @World of Healing Show. And until next time, keep smiling.